This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubeda Hamid, your host for today.
What is this one?
Withdrawing from the World Health Organization, sir?
Oh, that's a big one.
About 1 month ago, US President Donald Trump announced his country's withdrawal from the World Health Organization. This was not a completely unexpected decision. Mr. Trump had taken steps even during his first term to do so, but the Biden administration had chosen not to exit. The WHO has called for the US to reconsider its decision. Funding is a key aspect to this. The US is the largest contributor of funds to the WHO. In the weeks since Mr. Trump's announcement, the WHO has said it plans to cut down on spending significantly, but the larger question remains of how this move is going to affect global health. Another hit to health has been Mr. Trump's decision to temporarily suspend all USAID activity. USAID also works in the area of health in a number of countries, and this decision has thrown into turmoil programs providing services for HIV/AIDS, tuberculosis, vaccinations, hygiene and sanitation, and others. What is the near future of global health going to look like? Is it possible the US will reconsider its decision? Is the world overly reliant on the US, and is it now time for other countries to step up? We delve into these questions and more with Dr. Chandrakant Laharia, a medical doctor and a specialist in global health with nearly 17 years of professional work experience with the UN system, including the WHO and UNICEF. Hello, Dr. Laharia, and welcome to the Hindus in Focus podcast.
Thank you very much for inviting me for this podcast.
Thanks for joining us, Doctor. The US's withdrawal from the WHO has led to a lot of concerns about the impacts that this move could have on global health. Could you explain to us what the ramifications of this move will be, especially in countries that depend upon the WHO for crucial health interventions?
We are hearing a lot about US withdrawal from WHO, and definitely this is concerning. Though in between people often talk about that WHO receive a lot of funding from US, and that's with US withdrawal, that funding is gone. However, this challenge is much beyond funding. It's about essentially uh, strength of global health institutions which derives from its member states. So every single member state for a global health institution such as WHO is important. In that context, when United States has withdrawn from US, more than the financial component, it is about the reputation and functioning ability of organization which is getting dented or impacted. We also know that when WHO have one member less, or when US is withdrawing from WHO, US is likely to have its own alternate mechanism to support global health and global funding, which may and could impact WHO's ability to function as an international health agency. So that's part one. Second, and of course, an integral part is the financial component. We know that US has been a major donor as a part of membership subscription to WHO. And once US is withdrawing, a major portion of WHO funding will disappear. Third part is that while there are direct financial contribution to WHO, but US provide technical support, which essentially means it second or deploy number of US government officials to WHO who are paid by US government, and that is an indirect contribution to WHO. So putting all these three things together, one, US withdrawal from WHO is impacting its credibility reputation as an organization which is responsible for global health coordination. Second, direct financial contribution is getting coming down, and third is that indirect technical support which WHO was receiving from the US is coming down. So it would affect in multiple ways.
Break down the funding part for us. How does WHO funding work, and how much was US's contribution to it? And also tell us what the WHO used to do in terms of health services for low and middle income countries, and how these will be affected.
So WHO funding is one of the things which many people do not understand fully. So key point to remember is that WHO is not just another international or intergovernmental agency. WHO is one of the key UN agency, specialized UN agency, which provides support in field of health at the global level. Now, majority or a large part of its funding comes from member states, which is equivalent to a subscription fee for an international organization. When you become a member of organization, different countries agree to pay a certain prefixed amount to be part of that organization. So that's what WHO does. So every member state, this is a global term, when countries are termed as member state, because certain countries which are not recognized can still become member of WHO. So the internationally accepted term is member state. So each of the member state of WHO contribute a prefix amount. Now this amount has been set up a long back, around 1984, depending upon the country's per capita income and population. And by those norms, US is the biggest contributor to WHO funding as part of membership fee or subscription fee. This has been on agreed formula and going on for long. So that's why different countries pay different amount. US pays highest amount. Other countries in Europe or high income countries pay much higher amount. The countries which were not in the middle income or higher income pay relatively less. And that's where some of the references are being made that China is a large country, but it does not pay that high. It does not pay that high because the formula which had been devised and agreed among its member states has determined such approach that countries pay based upon per capita income and certain other formula. With this, US has been paying membership subscription for long, which is high. And that's why when US is withdrawing from WHO, it would impact a significant portion of WHO's funding. Now, I would like to break this into two parts. So there are two sources of WHO funding. One is called what I described just now, which is a membership fee or subscription fee. And all of this pool is together called assessed contribution or AC. So this amount is whatever total every member state pay makes a total contribution which is called assessed contribution or AC. This amount comes around 1.8 billion to $2 billion over a period of 2 years. Now, this is the amount which WHO keeps for, or this is the amount which ensures day-to-day functioning of organization at all levels. This is used for a secretariat function, maintenance, building, and also paying salaries of the long-term staff of WHO. So assessed contribution, what members pay, essentially ensures continuity of organizations functioning over a period of time, because we know that people or member states would be paying, so WHO can be confident in hiring staff which are required for long-term functioning. This ensures that organization would exist. What is going to happen with US withdrawal? A significant portion, approximately $400 million to $500 million of total assets contribution would disappear, and which would impact WHO's functioning in the sense that WHO need to secure that much money to ensure that all essential operations continue at all three levels of WHO: headquarters Geneva, its 6 regional offices, and other country offices. The other contribution WHO receives are called voluntary contribution. Now, these voluntary contributions are essentially non-regular and self-decided by various donor organizations and also sometimes by the countries. For example, a big philanthropist wish to donate some money for polio elimination, then this money, the voluntary contribution, will come to WHO. There are some other funders and donors who wish to support leprosy elimination. There are others who would like to support neglected tropical diseases. So this voluntary contribution essentially constitute what general public understand are projects. So these projects are time bound. They are not mandatory for the donors or member state, but any member state who is willing to support, or any donor who is willing to support a particular activity, give money to WHO, and then WHO use as per agreed mandate. So these two together, the assessed contribution, the subscription fee in general public term, and voluntary contribution, the donations which comes on an ad hoc basis, makes WHO total budget of for a period of 2 years. So in a 2 year period, the WHO does 2 year budgeting cycle. 2 year period, WHO spend around $4 billion, some from assessed contribution, other from voluntary contribution. The challenge with voluntary contribution is that it is unpredictable. It is not mandatory for the member states or a donor to give that money. Another challenge with voluntary contribution is that it's very tight jacketed. Like if it is given for a mother-child health related issue, it cannot be used in another program, which might require more funding. By assessed contribution has a definitive advantage that it ensures that WHO get that money and WHO can use that money to day-to-day functioning, but also other priority challenges or emerging disease such as pandemic funding, etc. So when US is withdrawing, it has withdrawn from assessed contribution, but it has also been one of the bigger donors for voluntary contribution in various programs. And the indirect financial support in form of technical assistance which used to come to WHO is also going to be impacted. And putting all of these things together, the assessed contribution will come down, the voluntary contribution will come down. And third thing is that there are many US based donors and there are other donors in different parts of the world who may not directly be impacted by US government decision. But because of US decision, they might also reduce the funding to WHO. So the impact is going to be far greater on WHO funding and WHO functioning than the direct contribution coming from US. And final part is that because US is withdrawing from WHO, and it would tactically and strategically impact organizations' reputation to support global health concerns.
Tell us a little bit about WHO's activities, Doctor. What are the kinds of health programs that they support? What are the kinds of successes they have had? And how will all of this now play out?
This is another important area which we need to understand. So WHO does not do its own activity. As I said earlier, WHO is intergovernmental agency. What it means? It means that all governments across the world and member states of WHO have come together to form an agency. So now WHO is an agency of all the government across the world. The highest decision making in WHO is World Health Assembly, which is made of health minister of every country. So in May or June every year, the World Health Assembly meets, and these meetings are attended by health ministers and health minister-led delegations from each of the countries, including countries such as India, United States, or all the countries which are member of WHO. These members states through the World Health Assembly make a decision that what need to be done at the global level. For example, when global community made a decision to eliminate polio elimination in 1988, it was not WHO which made the decision. It was the World Health Assembly which passed the resolution. And that World Health Assembly consists of health minister of all the country. So WHO, in a more simplified terms, is a secretariat function. It works as a secretariat for all the country to implement global health agenda and global health programs, which are agreed by the member states. So that is one thing all of us need to understand, that member states, countries such as India, United States, China, South Korea, South Africa, all the countries across the world have made WHO. They made decision every year to implement certain priorities initiative. And that's what WHO keep doing. Other part to remember is that, and let's go back to the initial contribution, that every member state has agreed to make certain contribution to WHO as part of assessed contribution. But those member states do not have any role or say in deciding that how WHO should use that money. WHO would use money to implement the decisions made by World Health Assembly. And WHO headquarters will decide that, okay, World Health Assembly has given this mandate, we would allocate or we would carry out those mandates and activities. So, for example, even India contributes certain amount to WHO's assessed contribution. And WHO spends certain money within India also. But Indian government, just to say an example, just to provide an example, cannot say that we give this XYZ amount of money, so we in our country, this full or this much amount of money should be spent. WHO Secretariat, based upon the mandate given by World Health Assembly, determined that where should they be spending the available and allocated resources. So by design, it happens that while a high income country or a higher income country provide higher contribution, but more money or resources are invested by WHO in a low income country such as DRC or Africa or anywhere which is conflict affected. So while countries have a role in agreeing on what are the priority, countries do give a financial contribution, which is a part of the agreed plan, but the WHO Secretariat prioritized based upon the mandate given to it, and it is spent on different areas. That's part one. So some of the bigger success of WHO has come from the very early part of the establishment of WHO in 1948. WHO has been supporting and implementing various tuberculosis control efforts. It has seen and witnessed a number of successes in the area of vaccine preventable diseases. And of course, we know about smallpox eradication, which was led and spearheaded by WHO. So these are some of the big successes. But at the same time, every disease cannot be eliminated. Every disease cannot be eradicated. But there have been success in areas such as guinea worm or yaws or kala ajar elimination. And the number of children and in some cases adults also who were dying due to measles 5 decades ago or 6 decades ago were far greater, which have also been drastically reduced. And all of these efforts are attributable to WHO. WHO has also been providing support in those areas and ensuring easy and timely access to the medicine, diagnostics, therapeutics. The WHO provide technical assistance in form of disease surveillance, technical guidelines, and more importantly, one of the function which is not sufficiently understood of WHO, that WHO, in addition to supporting disease elimination efforts and also providing collaboration for vaccines or diagnostic access, WHO is an normative organization. There is no other comparative organization as WHO is. So it helps in a formulation of various norms and standards which member states can use to set up health facilities, to procure drugs and diagnostics. So the functioning of WHO is more of a setting of norms on various aspects of healthcare services, which member states utilize. It does this on behalf of all these member states, which they can use, and which is a much bigger function of WHO rather than program or project implementation, which many other agencies also do. But no health agency at the international level is given mandate to set the norms and standards in healthcare, which only WHO does.
That was a very clear picture. Thank you, Doctor. Tell us a little bit about some criticisms. Now, President Trump, while signing his executive order to withdraw, has claimed that the WHO mishandled the COVID 19 pandemic. It did not adopt urgent and necessary reforms. What are your views on this?
So, in the wisdom of hindsight, everyone is wiser. The problem is that WHO is an intergovernmental agency. It works on behalf of the member states. It does not do anything its own. That's part one. Second part, related part, is that one of the criticisms which WHO received was that it was not able to secure data from one country A or another country B. But that is not the function or mandate of WHO. In fact, WHO has no power on any country, no matter which country it is, be it A, B, or C, any country. WHO cannot mandate or force that country to have data. They provide data or do something which can be recommended by WHO. WHO simply can request countries to provide data and utilize that available information. And that's what had been happening in the beginning of the pandemic and throughout the pandemic, that WHO was requesting different countries to say that share the data on number of cases, share the data on number of deaths. And when data was not available, WHO used estimates and other approaches to arrive on conclusion. But if some country is not sharing the data, WHO has no way to enforce or compel that country to provide data. So WHO was working in the restrictions or limitations of a global health challenges, and whatever information it had, it used that information to provide input and guidance. That's the way it was happening. Other part is that, of course, there has been blips or challenges which were related to availability of data and global guidance. For example, WHO for a while did not recommend use of face mask, universal use of face mask to prevent from COVID-19 or SARS-CoV-2 transmission, and later on it changed its stand. However, we need to understand that the science is about use of available information for a technical recommendation. That information in the future or later on might be wrong or right. So, what is important in a global health scenario, that available information is optimally utilized and vetted by the technical experts, and that's what WHO used. That approach WHO used for providing guidance. In some of those guidances, of course, some of the decisions could be very critical. There have been governments uh, which have which were not cooperating with the government, WHO, and that resulted in some of the tussles between different countries. But in my personal opinion, and because of the background I have shared, that WHO is an intergovernmental agency, does not generate its own data, it can only request member states, and of course, it is heavily guided by external and independent subject experts who advise Director General of WHO to make any decision. Director General of WHO does not make his own decision. He or she, depending upon which point of time in the history, is, is guided by those experts. And in that backdrop, if we see the context and the scenario of COVID-19 pandemic, WHO did a fairly good job with certain blips which we do not know whether could have been avoided or not avoided. However, in my opinion, the criticism by U.S. government or then U.S. president or now U.S. president is unfair and not fully substantiated.
Let's move on a little bit towards the USAID programs. Now, simultaneously, as President Trump signed the executive order to withdraw from the US, he also signed an order for a 90-day suspension of all USAID programs. And since then, the entire USAID setup has been thrown into turmoil. What do you think will happen next with this? Is this also a factor that can impact global health?
So, U.S. aid scenario is really unfortunate. It's unfortunate because the way it is being handled, that people, some of the contractors, if not the regular staff of USAID, lost the jobs overnight, while other regular staff have been put on the long leave. And we really do not know what would be the fate of those people when 90-day period is over. However, what this entire development reflect, again, two things. One is that an institution which had been there for nearly 5, 6 decades has been weakened in one go. And this is USAID is an institution which has been supporting globally on various areas of work, health being one of those areas of work. So one institution has been undermined or weakened. That's a key concern. Second thing is the way it has been done. There could be every other way would have been much better than this way. That overnight an institution and people associated with institutions are not sure that what is their fate. Third thing is that there is, of course, a lot of good work being done by USAID in most countries, including in India. Now, USAID is definitely a much bigger donor or funder to global health than any other institution. I don't have the exact numbers, but I was going through some of the numbers that while US, like the The numbers are something like a $40 billion of funding from US every year through USAID. That's one number I came across, but I also was also reading that in the health sector, USAID contribution around $12 billion per year. Now let's contextualize this. So $12 billion if a single agency is giving to global health, and WHO's 2 year budget is around $4 billion. So it's like definitely much bigger than the a bigger one of the big global institution in health. So USAID funding quantum was definitely much higher. Also, to put in the context, this USAID funding is nearly like 8 to 10 times bigger than the Gates Foundation funding for health. So it is definitely a much bigger funding for global health. And when USAID funding is gone, of course, the uh, the work, ongoing work or quantum of work which is happening on a health sector is suddenly collapsed or affected. But also, uh, I have touched about this in the earlier part of conversation that institutions such as WHO to get direct funding from member states, membership subscription, but also indirect funding from institutions such as USAID. So when USAID funding is gone or affected, it will affect funding of many of the institutions. What we also know that it may not affect all countries equally, but there are countries in Africa uh, and some other parts of the world, especially conflict-affected area, where this funding was a major source of continuing the civil society work and other health and nutrition intervention. So in those settings, it is going to be a major challenge, at least in short term. And also, and this is my sense that since the institution has been impacted by 90-day funding and stop work arrangement, even if it returns, it would not return to the full capacity, and it will return to only limited capacity, as we are already hearing. We don't know what does limited capacity means, but I'm afraid that this could be really a very low level, small scale functioning.
At a time when we've had one pandemic already, and for all we know, there could be another pandemic brewing, and at a time when countries still haven't agreed upon a pandemic treaty, is this a chance for other countries and perhaps the global south to step up? This is something that you have indicated earlier. With the US exiting the WHO, is it time for other countries to step in?
It is definitely a time for other countries to step in. I was always very uncomfortable, and I always believed that no single country, no matter which country it is, should have that much influence on the global health. However, that is what the scenario earlier was. However, I have written about this aspect, and I strongly believe that whatever is happening as part of US exit from WHO and then now with the USAID scenario, it is an opportunity for entire global community to look into that how we can make global health more equitable. Uh, I really wish that there are countries from global south and emerging economies which can fill the gap for WHO funding and also development sector funding at the different levels. Like it's theoretically a possibility that countries in Asia and other part Europe can fill the gap for what is being left behind by US and USAID. However, I am also aware about some of the recent discussion at the global level, like including executive board of WHO, where the appetite among us member states, other member states and other countries to fill in that gap was very limited, which essentially also reflect that most of the countries these days are inward looking, even though they talk about the global health and the global sharing, but what I know from various sources and what has been reported, that the appetite in other states and even in global south countries to increase their contribution to WHO and other global health initiatives is very limited. Uh, we are living in times where there is a more nationalistic attitude. Every country wish to take care of their own populations, and rightfully so also. But when it comes to global institutions and global resource sharing, we are yet to see the kind of scenario which we would like to develop for a shared common purpose.
But pandemics don't follow geographical national boundaries, do they? Is it time for people to relook this decision?
It is definitely time that countries should relook at this decision, especially democratically elected countries should focus upon that. Our countries are inward looking, and that they are trying to recover from the global pandemic which has already happened, and being fully mindful, and countries are aware that our next pandemic would be sooner than one can expect. But we also know historically that countries do not prepare for those kind of pandemic. In fact, the pandemic treaty which WHO has been talking about is not getting the kind of consensus. What should be the role of various countries, including India? Of course, there are a few things which are emerging from a current dialogue and discourse which are useful. One of the things which is emerging and which we expect that at least in coming few years, 2, 3, 5 years, much of the global discourse is going to be more of a trade dependent. That health dialogue, how much will be contributed to health is countries are likely to see in the context of the trade, what trade and what benefit will come to their setting. Since I brought this topic of trade, let me highlight that what India can do. For example, you can have global trade and you can still support global health. So, for example, India is a hub for generic drugs and vaccines for rest of the world. India should, while maintaining its national interests, can also provide low cost and high quality drugs for the other countries. It can do a South-South collaboration with many other countries, where its trade interest is also protected, but also it can provide the cost-effective interventions and medicines for the rest of the world. So for India, um, medicines, diagnostics, and global trade through it could be a platform for a global health. And of course, I'm a strong believer that India should contribute to global health institutions much better than it has been doing till now. Second part, and that's emerging from, I have discussed in earlier section of this podcast, but also USAID technical support, that the era of direct financial assistance and community assistance is gone, but time is coming, which is more about technical assistance. But unfortunately, countries like India and many other countries in global South have not invested enough in the institutions which train experts in the global health. Similarly, it does not. Many countries do not believe in sharing and sending their technical expert to other countries. I think that time has come that India and Brazil, South Africa, many other democratically elected countries and leaders in those settings, especially in global South, should invest in institutions which train their manpower or human resources into global health aspect. And these human resources could be deployed to WHO, could be deployed to different parts of the world where a disease outbreak is happening or pandemic is emerging. In fact, this is very relevant that alongside uh, reduced funding, we are hearing that in addition to US exit from WHO, in addition to USAID turmoil, USA US government is also reducing the human resources which um, they deploy through Center for Disease Control and Prevention, the disease detective or EIS officers. So we are seeing impact on multiple levels, and this is a gap which country in global South should fill in, and this is very fitting for a possible future outbreak, epidemic, and pandemic response. So we should be prepared for those aspects. Let me summarize these longish points. So one is that we have 3 points. One, in the months or years ahead, the global trade is going to shape the global health, which is whatever it is. So we should focus upon that global trade dialogues also contribute to increase global health funding. Second, countries such as India and in the global south should focus on building upon institutions which train human resources for global health. Third is that financial support for global institutions needed, but we need more of a technical support as well. And all of this should come from global south, and all of this should come a vision for 10 to 15 years to have a global capacity so we are prepared for any epidemic or pandemic.
Thank you so much for speaking to us today, Dr. Laharia.
Thank you very much for this conversation.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.